I was climbing in the Andes in a snowstorm at a very high altitude, and I started to get very winded. Then I felt, because I always feel when I have an abnormal rhythm, I felt it coming on, and I sort of braced, and then nothing. I could have gone either way at that point. That was the first time. It then happened over the next 10 years, another 6 times. So I've had 7 cardiac arrests.
There is one certainty in life, and that is death. Though most of us may try to ignore it, the reality of our inevitable mortality only becomes real when we lose a loved one or experience a personal tragedy, an accident, an illness, or simply aging. And it's suddenly in those rare moments of confusion or fear or acceptance that we begin to really think about questions that have plagued humanity for thousands of years. What is death? What happens when we die? Where does our consciousness, our self, go after death? And is there anything beyond? After all, much of what defines living is derived from what happens when we die. Up until now, death has been perceived as impossible to study with scientific rigor. How do we study a phenomenon that ultimately results in the loss of our subjects? The good news is that advances in science and medicine have afforded us with the opportunity for the empirical study of what happens when we die. And this is the remarkable scientific story of death.
Death is a concept that is continuing to evolve. If you go back 100 years ago, really, if I, as a doctor, came across someone and their heart wasn't beating, I just would say, they're dead. And it was as simple as that. When cardiac activity stopped, that was death.
Death is generally and traditionally been diagnosed clinically. So the physician will attempt to find a pulse, will assess for breathing, assess the patient's pupils, and generally, if the patient's pupils are fixed, dilated, there is no breathing, and there is no pulse, it is the clinical definition of death.
Death happens when any illness or an accident becomes so severe that it causes the heart to stop beating. This is medically called cardiac arrest. When this happens, blood flow stops in the whole body, and breathing, brain function, and all signs of life are lost. Now, throughout time, nobody could come back from this event, which meant the permanent and irreversible loss of life or death. For the first time around 1960, doctors discovered a way to restart the heart after it had stopped by pressing hard and fast on the chest and giving high amounts of oxygen, drugs, and electricity.
Cardiopulmonary resuscitation, if you think about it, is an outrageous concept. It's humanity's attempt to reject the age-old notion that when your heart stops beating, that defines death. And literally the idea is we're going to just pound on the chest, move air into and out of the chest, and literally pump the blood physically through the body to the heart and brain while we try to get to some definitive intervention to bring life back.
As a result of this system of cardiopulmonary resuscitation, or CPR, some people who would otherwise have been permanently dead could be brought back to life. And this started to challenge the way we think of death. Society largely dealt with this challenge by simply referring to this same event using 2 different terms. So we call it cardiac arrest when doctors are actively trying to restart the heart, and we call it death when they've stopped or they've decided not to intervene in the first place. This distinction, which is largely semantic, has helped avoid public confusion between life and death, but they're referring to the same biological process. Now, at the same time, around the birth of intensive care medicine in the 1950s and 60s, something else also started to challenge our understanding of death.
There are two ways to die, two modes of death. The principal one that we all know about is cardiac death. When the patient's heart stops beating, there's no oxygen going to the brain, and you're pulseless apneic, which means not breathing, and you're dead. Starting in the late 1960s, we recognized there was another way to die, which is brain death, or death by neurological criteria. Brain death happened because of medical technology. It happened because of life support and respirators. And it was recognized that after catastrophic brain injuries, trauma, bleeding into your brain, these diseases could effectively kill off the brain permanently, to the point that there's zero brain function and no blood flowing to the brain at all. Yet the heart's still beating because the ventilator is sending the oxygen into the lungs. So around 1968, formal criteria were written recognizing and endorsing brain death as an entity, a valid way to die.
So today, the vast majority of people, 98% of the population, are declared dead by cardiopulmonary criteria. That is when the heart stops beating. And 2% are declared dead by neurological criteria or brain death criteria. But in order to understand what happens to us with death, we need to understand what happens to the brain after the heart stops.
The brain is 2% of the body's weight, but consumes 20% of the oxygen. So it's very high maintenance. So when a human being is deprived of oxygen in a cardiac arrest, the brain gets hit hardest and starts to become irreversibly damaged earliest. That process begins. What we thought was that as early as 5 minutes after the initial deprivation of oxygen, the brain cells start to die. And they're dead. And once they're dead, they can't come back. What we understand now is that the cells are recoverable, but the initial 5 minutes of lack of oxygen triggers an active dying process that plays out over hours.
The fact that brain cells don't die quickly after oxygen deprivation and death in a cadaver is a major scientific paradigm shift. It contrasts with everything that scientists have believed for decades, which is that brain cells die within just a few minutes of oxygen deprivation. That has progressively been shown to not be true at all. But then came another challenge. When doctors restarted the heart after CPR and put oxygen back into the brain, they found that the oxygen itself became toxic and caused the brain cells to die quickly.
That opened up a new field of science called reperfusion injury. How did I bring the oxygen back to my brain? If we do it, I'm going to say very carefully, we know that that 5 minutes can be stretched. And scientists now know that the reperfusion injury is a big part of why people die when we try to bring them back to life.
For decades now, scientists have been looking at different ways to improve the chances of restarting the heart, and to also reduce the oxygen deprivation that the person has after the heart stops. Some of these involve the use of special machines that can deliver better chest compressions than what people can deliver by hand manually. One of the most promising methods, which can also substantially reduce oxygen deprivation, after the heart stops beating is called extracorporeal membrane oxygenation, or ECMO. And this is a system which involves siphoning blood out of the body using special catheters in the groin and the neck, putting it through a membrane, giving it oxygen, and then pumping it around the body again.
After a lifetime in the field of resuscitation science, my concept and understanding of death has changed considerably. I've been lucky enough to be involved with a newer approach to resuscitation called ECMO. It is life support. And I've been involved for the past 15 years applying this technology to patients in cardiac arrest. And we have been able to demonstrate a 45% neurologically favorable survival in that patient population. So throughout my lifetime, we have gone from 3 minutes without oxygen to now over an hour.
There are also ways to prevent cells from decaying and to fight the reperfusion injury. One of those, perhaps the most prominent, is hypothermia, which involves chilling and cooling the body in an effort to preserve the cells, much like how we do when we put something in the refrigerator. There are also medications that can augment this effect and enhance it. So in this way, physicians can keep people whose hearts have stopped in a sort of hibernation state. They're dead, but they're hibernating. And this will then potentially give doctors time to go and fix the underlying issue that had caused the person to die, assuming that it's fixable, and then try to restart the heart again.
Hypothermia, we've known for a long time, decreases the need for oxygen in major organs and the whole body. And the colder you get, the lower the demands for oxygen are. So emergency preservation and resuscitation, or EPR, is the technique that we've been working on for many years now to try to utilize mostly hypothermia to try to decrease the oxygen needs for the brain and the heart, to allow surgeons to quickly stop the bleeding in somebody who's had a cardiac arrest from trauma. What can happen though is when we then restore the blood flow, cells and major organs are kind of primed to then have what's called a reperfusion injury, a reoxygenation injury, and obviously it's a big challenge because you got to restore blood flow. And kind of the question is there a way to do that that's safer for cells, better for cells than just quickly giving blood and oxygen back to cells? And that's certainly a big area of interest in science.
The fact that brain cells don't die quickly after we all die and become a cadaver has another major scientific ramification. It has meant that over the past 20 years, scientists have been able to routinely go to the mortuary and take pieces of dead people's brains, some 4 to 5 hours after the person had died, and then grow brain cells, or what we call mini brains, small tiny little brains, which are referred to as brain organoids, in the laboratory. And they're doing this in a quest to discover new treatments for severe brain diseases such as Parkinson's disease or stroke.
Brain stem cells, they are quiescent stem cells that resides in specific regions of the brain, such as the hippocampus. And of course, when they are deprived for nutrients, they go quiescent and they just stay there. But they are ready to come back under the proper environment. So the experiments with cadaveric brains show us that if you provide them with the right environment, they will start to proliferate again. So it's not that they were dead, they were just quiescent, they were silent, hibernation. You can bring them back and stimulate them to proliferate. This simple experiment gave rise to a whole new field. If we can take stem cells from the human brain that is already post-mortem, can we reconstruct the brain using those stem cells?
For more than 20 years, science has shown that we can take pieces of the brain from dead people and grow mini functioning brains in the laboratory. But it's one thing to get brain cells to grow again after death. But a key question that had remained for decades has been, can we ever get the whole brain to work again after death? That is a much bigger challenge.
Every 5 or 10 years, a study will come out, and by the end of the day it comes out, the emails are pinging all over the world. And this was one of those studies. This was outrageous. This was the pig study. So, what did these researchers at Yale do? They went to a slaughterhouse and they got the decapitated heads of dead pigs. And these pigs had been decapitated some number of hours before. And they have this contraption where they plug in effectively an artificial circulation to the dead pig head. They do all this metabolic monitoring, electrical monitoring, and they proved that they could restore life and metabolic function to the brains of these pigs.
That is an amount of time that no scientist would believe would be something that would bring back normal brain function, ever. They were able to restore a heck of a lot of function to the brain.
The scientists were so concerned with the ramifications of the discovery that dead brains could be revived again hours after death, that they had prepared drugs to sedate the dead pig brains in case they had become conscious again. They actually stopped the experiment, downplayed their own findings, and declared that the dead pig brains had not been conscious again, but were in fact metabolically, in other words, biologically active, but not alive. Which doesn't make a lot of sense, because if the brain is biologically active, then it must be alive. Now, while the world media reported on this, they and most other people did not quite realize the huge ramifications that this and other recent scientific breakthroughs were having on our understanding of what happens when we die.
I can only imagine that this is translated to other species as well. I don't think there is anything special about the pig brains, so I would assume that the same is true for the human brains. So if you are to reproduce his experiments with the human brain, I think he would achieve very similar results.
So what does that mean for us? So what it means is that for the people who are really thoughtful, it means there's now this like gray zone. It might be death, but it might not be death. It's the gray zone. My own belief as a scientist, it's going to depend on how we restore function. It's that process of bringing the computer back online after it's been turned off for a period of time that is going to determine whether we do it successfully or not. Those are the frontiers of brain death and recovery and avoidance of brain death that we're now looking at.
In principle, by thinking of death not so much as an end, but as the beginning of a new process, an entry into uncharted territory, instead of giving up, doctors can now start to actively look for new and novel treatments to halt and then reverse death before it gets too late. However, many people find it very hard to accept the notion of a gray zone after death, in which people are dead but can still come back. And they believe that a person who has returned to life was never truly dead. But experts are showing and suggesting that medically speaking, people could be dead from a biological perspective and still be brought back to life again. And so this then leads to the natural question, where did they go during this period of death?
I think the study of consciousness in cardiac arrest research is one of the most important questions, and it, I think really touches upon questions of what does it mean to be human, what does it mean to be alive, how do we formulate an identity? I think that we know very little about what is going on for this person and this person's awareness during the time of a cardiac arrest. People have described things afterward and kind of recalled things from the room when they were in cardiac arrest, or kind of described seeing their lives flash before their eyes, or kind of other very vivid experiences. And, what is happening there, we just don't know. And I think it is a very important question to explore in the care of these patients.
while seemingly not conscious from the perspective of others who are looking at this person, and others who might even be attempting to revive the individual medically, from the perspective of the person who's going through death and who's entered into this state of coma, paradoxically, there seems to be a continuation of lucid thought processes and consciousness without physical pain or distress. What if during this period of seeming unconsciousness from the outside world's perspective, a fascinating, lucid, transcendent, meaningful, and purposeful experience emerges that follows a very specific narrative?
There are accounts of what we now call near-death experiences from ancient Greece and Rome. And in fact, every culture in which people have looked for histories of near-death experiences, they found accounts of these. It was Raymond Moody, actually a medical student at the time in 1975, who used the term near-death experience for the first time in English. And he had, in medical school, asked his patients who had been close to death what they remembered of the experience. He found about 150 of these cases in his patients during the course of his medical school. And in 1975, he wrote a book called Life After Life, in which he used the term near-death experience and the acronym NDE. And that was the name that stuck, for better or worse.
Based on the scientific and medical advancements of recent years, we have evidence to believe that many of the people who've described their experiences had gone beyond the gray zone of death and returned to tell their stories. So this means that the term near-death experience is in fact a misnomer, which is why recent studies have re-established a new terminology for referring to these phenomena. We now call them recalled experiences of death, or REDS for short.
It was my first day as a doctor. I was, I think, justifiably terrified. I had a second-year resident who was supervising me, who promised me that he would cover my back and be present throughout the entire 36-hour period. So I went up, I introduced myself to this patient, and the patient's eyes rolled up in the back of his head, and he fell back onto the bed lifeless. So I dove on his chest, I started CPR, and initiated resuscitation practice. Eventually, his wife showed up, and the nurse came in and said, "Will you please talk with the wife? I'll shock the patient if he rearrests." So I went out and talked to her and was not very optimistic in my discussion with her. About 11:30, his lunch showed up. Well, I hadn't had breakfast and I hadn't had lunch, so I went ahead and ate his lunch. Finally, about 1:30 in the afternoon, he finally stabilized, had a return of pulse, and that pulse was stable. The patient had a very rocky course, was in the hospital about a month after this. And on the last day, I walked into his room. He said, "Tom, please sit down, shut the door." And I did that, and I said, "Well, what can I do for you?" And he said, "I had an experience during this arrest that has been bothering me for a month, and I need your help." He then explained that he had left his body, and he explained everything that I had done, that I was doing CPR, the shocks. He followed me down the hallway to my discussion with his wife, and he said, "You know, I thought you were pretty pessimistic about my options, and you should have been more optimistic, Dr. Aufderheide." He said, "And if that wasn't bad enough, you ate my lunch." So that all was a insight for me, but then he really said something that got my attention. And he said, and I thought it was unusual that here I was dying in front of you, and you were feeling sorry for yourself because your second-year resident had left you alone and wasn't supervising you. Now, I had never verbalized that embarrassing thought to anyone, but he told me what I thought, and that really got my attention.
My adventure began in January of 1999. We went to South America with friends of ours for a week of kayaking, of whitewater kayaking. We kayaked for the first week and had a wonderful time. And on what was going to be our last day of whitewater kayaking anyway, we decided to paddle a section of river that's well known for its waterfalls. I went down this drop or this waterfall, and the front of my boat became pinned or stuck in the rocks and the underwater features. And while I was still upright in my boat, the water then completely submerged me and the boat. And as the time ticked on, I knew that I was in a bit of a predicament. And at that moment, I was immediately overcome by a very, very physical sensation of being held and comforted and reassured that everything was fine. My husband would be fine, my young children would be fine, regardless of whether I lived or died. And I was still me. I still had my same pragmatic, analytical sense about me. And I was experiencing this incredible sense of not just calm and peace, but this incredible sense of absolute love. I really was sort of amazed. I was thinking, wow, I'm not afraid. I don't feel panic. I feel great. And then I was taken through a life review that was like nothing I personally could have imagined.
One collection of phenomena are changes in your thought processes. Your thoughts seem to be going faster than usual, they're clearer than usual, they're more vivid than usual. You may have a complete review of your entire life, and this is happening again in the context of likely brain damage, or at least severely restricted oxygen to the brain, when you would not expect much of an experience at all, let alone hyperacute senses and rapid, clear thinking.
23 years ago, I had a horrific automobile accident. The whole family was in the car. It was myself, my wife, and our 2 young sons. When the car came to a stop, I was completely conscious. All I knew is I had crashed the car. My young 7-year-old was crying hysterically. I couldn't move. I was pinned. I couldn't get to him. And yet that was the brutal reality that no one else was crying. My wife and my youngest son had both passed. They were both killed instantly at the scene. But it was in that darkest moment that something very profound happened. It felt like light came to me. I literally felt like light came and surrounded me, and the light felt tangible, almost comforting, and it felt as if I was rising above the scene of the accident. My wife, who I knew was deceased at the accident, she was there in the light with me. And we began to have this conversation where she was emphatic that I go back. You can't come, you've got to go back. And we were literally having a very intense conversation about the fact that I had a small son, a 7-year-old son in the backseat of that car that was okay. And if I went with her, he would be orphaned. And I literally made a choice. I made a choice to come back into this realm.
When I was 20 years old, I gave birth to my first child. It was a very traumatic labour, through which I lost a huge amount of blood, and I was required to have a blood transfusion. And within a couple of hours of the blood transfusion starting, I started to have a reaction. The next thing I knew, there was an oxygen mask on my face, and that's when I was just mentally thinking to myself, what's happening? And I noticed that my nails were turning blue, and that's about the point where I thought, oh, I'm dying. Pretty much straight after that, I'm going to say flying. I'm definitely going up, I'm going forward. There's a presence with me. and we're shooting up and forward in what I can only describe as a tunnel. We did that for a while, and then we stopped, and the scene completely changed. I was in a room without walls, without a ceiling or a floor, and yet it felt enclosed and personal. A big screen appeared. You could call it a screen. And it was playing my life. And I was watching it, and then I was reliving it. And I was in that moment, as if I just traveled back in time straight into that second. And with my new awareness and this perspective that was vastly different to the one I had while in my body, I was sort of judging myself. I was just exploring each moment with, how did I respond in that situation? Could I have done that differently? Was there a better, more loving approach to that situation? I would relive these heated arguments, feeling in the perspective of the other person who's at the brunt of my harsh words as I'm launching them, without real thought. And I would then stand in the other person's perspective, perhaps it was my mother or my father, and really feel how hurtful that was. And that stayed with me as well.
In this life review, the most horrible, painful events of my life, in which I very deeply hurt someone else, sort of went across, I'll say the sky, but it wasn't really the sky, but it was kind of here. When the event unfolded and I was once again absorbed into that event, intellectually I could recognize and remember my emotional response to it, meaning remembering the guilt or remorse that I felt after I'd hurt someone else, or the anger. There was this absolute shift in time, dimension. I could experience thousands of things all at the same moment in time, but I was experiencing each of them independently. I knew too much time had gone by to still be alive, but I never had the experience of feeling alive and then dead. I had the experience of feeling alive and then more alive, conscious and then more conscious, because this experience was absolutely more real, more intense, more vivid than anything I've experienced here on Earth.
Who I am on this earth, Robert Montgomery, is in a way like the earth. And this other consciousness is like the cosmos. And I think that we're not aware of that because it's just too vast to imagine, and that's how it felt. And I think it's drowned out by all light. And it was always like that. Same. Every time.
When these experiences were first described almost 50 years ago, which is a few years after CPR was discovered, many initially tried to dismiss them, or they categorized them as a sort of a brain disorder, an unreal experience that was related to the trauma or accident or illness that had been sustained by those people. But today we recognize that that's not correct. The paradoxical presence of lucidity and the ability to recall real, verifiable events, as well as a meaningful, accurate review of their lives, suggests these can't be dismissed as unreal experiences, whether you want to categorize them as hallucinations, illusions, or delusions.
Because people have these visual experiences sometimes in their mystical states. The implication some people draw from it when they hear that is that they're not real. And we don't find that. People don't report that. I want to move away from the fact that people just see this as a host of hallucinations that have nothing to do with consensus reality, that are a drug effect. More importantly, it seems to be something along the lines of everything is within the psyche, and the psyche can produce profound images and even visualizations that may have meaning, versus frank hallucinations that may not be connected in some way to insight.
Many patients have a delirium or will have hallucinations due to severe life-threatening illness. Those patients are generally confused, they are disoriented, and it is distinctly different than what people with a near-death experience report. People with a near-death experience report clarity. They will return with very clear, focused messages and a purpose to their life. This is completely different from an acute, confused, delusional state.
What we're seeing is something completely bizarre. That what we're seeing is as the brain is shutting down, this disinhibition of brain processes is leading to the activation of certain parts of the brain that are enabling us to access realities in ways that we couldn't do before. And that these people are now coming back and reporting something that they would otherwise not have been able to access. And all of this leads to the natural question: how are the brain, mind, and consciousness connected? This is, of course, an ancient question.
The question of consciousness is as old as humanity. But if we take an arbitrary kind of starting point in the kind of beginning of Western philosophy and think about Plato and Aristotle and ancient Greece, the language is really about body and psyche, and later body and soul. The contemporary kind of debates around consciousness are often talked about in terms of the hard problem of consciousness and then the easy problems of consciousness, which is maybe misleading because they probably are all hard problems. But I think what's meant by the hard problem of consciousness is the relationship between the physical brain and consciousness. So it just dates right back to this ancient problem of psyche and body, or mind and body, and how to bring the two together.
But when exactly is a being said to be conscious? What about the pig study? Did those brains ever become conscious again after they'd been dead? And what about patients who are in a vegetative state? Are they conscious? In fact, how do we even define consciousness? And what is its connection to the brain?
There's two big ways that you can approach consciousness: a monist approach or a dualist approach. And a monist approach says there's only one kind of thing in the universe, fundamentally. And maybe that thing is just physical stuff, space and time and particles. In which case, consciousness will have to, in some sense, be dismissed. You think that you have conscious experiences, but you're really just a bunch of particles. Dualism says there's two kinds of stuff in the universe. There's physical stuff like space and time and particles, and there's consciousness stuff. And that is more stuff like experiences of headaches, the smell of garlic, the feeling of velvet, the feeling of love, the sound of a trumpet, those kinds of experiences. The physicalist approach to consciousness, which says that brain activity causes consciousness, does face a problem with the new empirical results that we're getting from resuscitation of patients after an hour of no brain activity. And these patients routinely are reporting very, very clear conscious experiences, seeing a white light, a tunnel, a life review, and so forth. And so all of the physicalist theories of how brain activity could cause conscious experiences are completely incapable of explaining these conscious experiences.
There is a huge element of unknowns around this question of what is happening at the time of cardiac arrest, and when people are doing CPR on somebody's body, where is that person's consciousness? What is happening then? And people frequently come out after an event like that and can describe things that were happening in the room, can describe vivid experiences and memories that they were having. And this goes against everything that we know about how brains function. In the brainstem, there is a pathway that kind of sends impulses up to the brain and kind of consistently is sending alertness messages, and this is called the ascending reticular activating system. You have to have that intact to be awake. And then in order to experience conscious awareness, we think you also need a variety of higher level brain networks. In the setting of cardiac arrest, where presumably most of those are offline, how are people having these events? How are people laying down memories when the memory networks are not working?
Death is still a mystery, but what we do know is that neither biological nor mental processes seem to end with death, and that with the exploration of death, we are now charting into a new territory in science and medicine, much like charting into the deepest depths of space and into the complete unknown. What exactly happens to our consciousness ourselves after death remains unclear. But science does, at a minimum, suggest we do not seem to become annihilated when we cross over into death and into the great unknown, and that perhaps human actions, human thoughts and intentions do matter.
I've certainly seen patients close to death have that kind of eye-opening awareness experience. I've seen instances of patients who were minimally conscious for days who came out of it hours or a day before dying, having absolutely lucid conversations with their loved ones, going into the depths of their relationship that they hadn't ever done before. So I could see how that intensification of awareness happens in a way that we would have difficulty accomplishing on our own without that moment of death facing us.
Patients have told us things that we can't explain. And so our temptation is to just sort of brush it off in one way or another. And I think that that's probably not the most helpful way, and it's not certainly the most scientific way to approach it. I think instead we should try to understand it more and learn what we can about some of those stories that are some pretty hard to explain stories otherwise.
Based on the experience and as I look at my life, it did change me. I'm not afraid of death anymore. I know that. I mean, I quite look forward to it sometimes. It's like, yeah, this let's be done with this and move on to the next thing.
I did emerge from these experiences kind of questioning why I had survived. I had this sort of very clear feeling that there was work, earthly work that was undone and hadn't reached where it was intended to go. And so I feel very driven by that there's some reason why I'm still here. And I need to find out what that is.
Science and medicine have significantly evolved our understanding of death, and that includes ways to prevent it and now perhaps even ways to reverse it. Although systematic studies have not been able to absolutely prove the reality or meaning of people's experiences and claims of awareness and consciousness in relation to death, it has been impossible to disclaim them either. We may not have all the answers yet, but for now, what we know definitively is that there is one certainty in life, and that is death. And that death itself is not what we thought, and it simply seems to be the beginning of something new.